My name is Jason White. I'm the director here at the Connecticut Agricultural Experiment Station, or CAES. I'll make a few brief comments, and then I'll introduce Dr. Gudars Malai, who's our scientist that runs our tick-borne disease surveillance and research program. And then, of course, Senator Blumenthal, who we're happy to host, will make some comments. So CAES is a very unique institution. In addition to being the oldest, the first agricultural experiment station in the United States, we're actually also the only experiment station that is an independent agency of state government. All of the other experiment stations in the country are part of land-grant universities. So as a result, our mission is a little bit different. And our motto is putting science to work for society. And our vector-borne disease program is really the perfect example of that. Our tick-borne disease research and surveillance program goes back many years. And over much of that time, there's really been no greater advocate for our work specifically or for the public health issues and concerns associated with tick-borne illness than Senator Blumenthal. So we thank him again for his support over the years and are happy to host him. But first, I'll introduce Dr. Gudars Malai, who's going to give some important program updates on what we're doing.
Honorable Senator Blumenthal, dear guests and media representatives, I would like to thank you sincerely for many years of support to our institution, more importantly to our tick and tick-borne disease surveillance program, also known as Tick Testing Laboratory. In Connecticut and throughout the United States, as you know, ticks and tick-borne diseases has increased substantially. And over the past decades, the rate of novel tick and tick-borne diseases has also accelerated. And the geographic range of these ticks have substantially expanded. Right now, tick-borne diseases constitute more than 90% of all vector-borne diseases in Connecticut and throughout the northeastern United States. And that number has increased, has more than doubled since 2004, with a total number of 450,000 annually. Connecticut has witnessed range expansion and establishment of 3 important tick species, including longhorn tick, Gulf Coast tick, and Lone Star tick. This is in conjunction with the pervasive population of black-legged tick that is the vector of 7 pathogens responsible for Lyme disease, babesiosis, anaplasmosis, among others. 2 years ago, we made a pledge to you, Senator Blumenthal, to work very hard to earn your further trust. And today, I am pleased to report to you some of the programs that we have initiated and progress we have made. Number 1, we have increased and improved tick testing capacity by acquiring high-throughput equipment, and this has allowed us to serve a higher number of residents in Connecticut. We have also developed newer techniques to test for Borrelia miyamotoi and Poisson virus, among other tick-borne diseases, including those responsible for Lyme disease, babesiosis, and anaplasmosis. And I'm pleased to report to you that in 2023, we have served nearly 6,000 residents of Connecticut. Number 2, we are working on a project to better understand barriers to engagement in our passive tick surveillance. In other words, we have noticed that submissions of ticks to our laboratory from those rural areas that have higher risk of Lyme disease and other tick-borne diseases over the years has substantially come down. And we wanted to find out exactly what are the reasons for this decreases in the submissions. We have recruited 4 graduate students from Yale School of Public Health, and we are working closely with 2 faculty members in order to address this issue. Number 3, in recognition of higher incidence of Poisson virus in recent years, we have started a project to estimate the prevalence of Poisson virus infection in black-legged ticks, as well as assess the disease outcome in patients. This is a collaborative effort between our institution, Yale School of Public Health, and the CDC. Number 4, in recognition of established population of Lone Star tick that is also associated with alpha-gal syndrome, we have recently started a project to determine the frequency of alpha-gal syndrome in areas with established population of Lone Star tick in the state. This is a collaborative effort between CDC and our agency. It is important to note that based on recent estimate, the number of alpha-gal syndrome has reached to 110,000 between 2010 and 2022. And recently, some of our neighboring states have identified that alpha-gal syndrome is number 3 tick-borne disease or condition as a result of tick activities, and we want to understand what is the status of alpha-gal syndrome in our state. In response to recent increases, this is number 5, in response to recent increases in the cases of Rocky Mountain spotted fever that is transmitted by black-legged, by American dog tick, we have started a project in collaboration with the Connecticut State Department of Public Health as well as CDC, and we are currently testing American dog ticks to find out what are the reasons for recent increases in Rocky Mountain spotted fever cases. I want to let you know that we have had 60 cases of this disease since 2016, which is quite high and concerning. Number 6, in 2021, we reported established population of Gulf Coast tick in Connecticut, and we monitored the population of this tick species throughout the state, most importantly in Fairfield and New Haven counties. And we found out at the time that over 30% of these ticks are infected with a disease agent similar to that of Rocky Mountain spotted fever. We continued our work on this tick species, and last year, for the first time, we identified an infectious tick that bit a resident of Connecticut in her 30s, and immediately we informed the physician as well as the patient, and we coordinated with CDC, and together we were able to make diagnosis, and the physician made attempt to treat, and fortunately the outcome was quite successful. And right now we are working with New England Journal of Medicine to report this finding as the first human disease cases in the northeastern United States. Number 6, we are investigating distribution, phenology, and infection status of the longhorn tick. As you know, longhorn tick is a prolific and problematic tick throughout the eastern United States mostly. It was discovered in 2017 in New Jersey, and now it has moved to 232 counties in 19 states, including Connecticut. We were the first report, the first human biting specimen of this tick from Fairfield County, and established populations of this tick in Fairfield and recently in New Haven counties, as well as the infection of this tick species last year with pathogens responsible for Lyme disease and babesiosis. We also identified for the first time partial blood feeding in this tick species that increases this tick ability to efficiently and effectively transmit pathogens of concern. And finally, we have engaged in numerous outreach activities on ticks and tick-borne diseases. We have presented talks to health department, physicians group, community groups, and healthcare providers. We have prepared brochures and educational materials and organized symposia and workshops to inform public about the risk associated with tick and tick-borne diseases.
Thank you very much, Doctor, and thank you, Jason White. Thank you to all of the staff of the Connecticut Agricultural Experiment Station. I am really pleased and honored to be back with you. I've been here many times, and I've watched and marveled at the research that you're doing, which is reflected in that excellent report. Thank you very much. And I must say that I'm deeply impressed by the progress that you've made, the contributions that the Agricultural Station is making in real time to scientific progress against tick-borne pathogens. They're called pathogens for a reason. They destroy lives. Lyme, babesiosis, powassan, the collection of tick-borne diseases debilitate and even destroy lives in Connecticut and all around the country. And they are growing worse. We're in a battle with ticks, and the ticks are threatening to win. Part of the reason is climate change. Ticks are moving northward. Those Gulf Coast ticks, the longhorn, the other exotic ticks that nobody has identified previously, they are coming to Connecticut and the Northeast. It's a pattern that has existed for a while. It's an alarming and deeply frightening pattern of ticks finding warmer climates further north as a result of climate change. And likewise, this warm winter has made the tick population even more threatening. There are likely to be more of them with the diseases that they carry. Now, people can safeguard themselves by wearing the right type of clothing, using insect repellents, going to places where ticks are less likely to be, inspecting themselves and their pets, most important, their children, for ticks, testing the ticks so that they know if they have found a tick on themselves, whether they are at risk. But the main point here is that science can help us with following the pattern of tick populations and the progression of these diseases so that we can safeguard ourselves, but also potentially invent vaccines and even cures and treatments. And that is why I have fought for years. You can be forgiven for regarding my little speech here as somewhat repetitive of what you've heard in past years, because I've said much the same message year after year, but it's having an effect. We are now investing as a federal government in fighting tick-borne diseases as never before. And let me just give you some numbers. $27 million in this year's budget for the National Center for Emerging and Zoonotic Infectious Diseases. $5 million for the LymeX initiative, which didn't exist just a few years ago. And $100 million for Lyme and tick-borne disease research to the Department of Health and Human Services. Maybe most important for you, I'm very pleased to announce $239,000 as an earmark, a congressionally directed spending grant for the Connecticut Agricultural Experiment Station. And the reason is quite simply the excellence of the scientific work and the urgency of monitoring and developing research against Lyme disease, babesiosis, powassan, the whole combination of vector-borne diseases which present such a threat to Connecticut and to our country. This is real money that was not being invested just a few years ago, and it is the result of staunch and steadfast advocacy by you, your scientific findings, as well as by many of us in Congress who are so deeply concerned about it. And those numbers reflect also, unfortunately, an increasing incidence of these vector-borne diseases, which have increased over the last 10 years by 338%. That's a 338% increase in Lyme, babesiosis, powassan, all of these diseases, some of them whose names you can't pronounce, but they are deeply dangerous. They are destructive. And unlike the eclipse, which we can't control, these vector-borne diseases can be successfully combated. And we should make every effort to do so because they are so destructive. They may not cause death, but they are deeply debilitating, particularly to young people whose disease may be mistaken for laziness or adolescent resistance. And that is why, for young people particularly, it is such a dire problem. And I'll just conclude with this note. A lot of this disease is underreported and undiagnosed. That's part of the tragedy here. It's underreported because it's either undiagnosed or our present reporting system fails to capture all of the numbers of cases. Local public health departments still often neglect to report the incidence of testing where Lyme or other diseases are found. And so this disease is underreported, which means we see only the tip of the iceberg in terms of the numbers of cases and the seriousness of this disease. And I believe that the new funding today can make a tremendous difference in combating Lyme disease, as well as other related ailments and the ticks that spread them. These ticks are an enemy. They may not mean to be an enemy. They're born by deer or our pets into our homes, and sometimes simply adhering to clothing or to the skin and unfound until they spread the disease. So people ought to be aware and wary when they walk in the woods, when they do gardening, when they simply play with their pets or their kids. Check your children. Make sure you check yourself. And if you find a tick, make sure the tick is tested and that you take action if you find that it is Lyme, because there are potential treatments before it gets more serious. So thank you very much for having me today. Again, I want to thank the Connecticut Agricultural Experiment Station for the great work you're doing here, not only on this, but on so many other issues. And I'm going to continue to be a strong supporter. Thanks.